Hi everyone. This study looks at the risk modification of acute pancreatitis through dietary intake and the production of bacterial and metabolite hydrogen sulfide. A little bit about the background of the study. The acute pancreatitis is a major healthcare burden. African Americans are at increased risk for acute pancreatitis with higher mortality and morbidity, indicating the presence of healthcare disparities. Our hypothesis is that a diet high in fat and protein is a disease-modifying factor that contributes to acute pancreatitis severity and disparity through its impact on sulfidogenic bacterial production of hydrogen sulfide, triggering oxidative and inflammatory injury. If you look down at the left-hand corner, you'll see that this is a longitudinal study of acute pancreatitis in control participants. We have 4 subgroups, as you can see down in the left-hand corner. The way we designed this study is that when acute pancreatitis patients are admitted, we administer 2 types of questionnaires. One questionnaire is a 24-hour dietary questionnaire prior to their admission, and the second questionnaire is a 3-month questionnaire of their dietary habits 3 months prior to their admission. We also collected stool and blood samples as well. As you can see here in the results section, we subdivided our participants based on their racial groups. You can see that African Americans had a diet higher in total trans fat and had higher consumption of fried food. Non-Hispanic whites had increased alcohol consumption, and Hispanics had a diet higher in vegetable protein and total whole grains. If you will look over on the far right-hand corner on figure 2, when comparing acute pancreatitis to controls, you can see that acute pancreatitis patients had lower consumption of fish, cholecalciferol, and erucic acid, which are known to be beneficial. If you look at our final figure in the study, figure 3, you will see that acute pancreatitis patients who had moderately severe or severe acute pancreatitis had higher levels of hydrogen sulfide in comparison to controls in mild acute pancreatitis. In conclusion, we can see that there are distinct dietary patterns among African Americans, Hispanics, and non-Hispanic whites. Also, there's distinct dietary patterns among acute pancreatitis patient and control subjects, which need to be taken into account in acute pancreatitis studies. Hydrogen sulfide levels are elevated in moderately severe and severe acute pancreatitis. And lastly, diet and hydrogen sulfide metabolism and related gut microbiota can be considered as potential targets in acute pancreatitis.